Hi, my name is Karen Minke, and my topic for this health communication campaign is focused on latent tuberculosis infections, or LTBIs, among the refugee population in the United States. So, LTBIs are when an individual is infected with the tuberculosis bacteria, but is not in active disease status. Many of the refugees that resettle in the United States have been diagnosed with LTBI. And without treatment, this can progress into active TB, which is very contagious. Over 70% of new cases of active TB reported in the US occurs as a result of reactivation of LTBI, especially among foreign-born people. And although the overall rates of TB is decreasing in the United States, in 2011, the rate of incident TB cases among refugees was 12 times greater than among US-born individuals. So the problem lies in the fact that refugees have very low compliance rates for completing the LTBI treatment regimens. According to a study conducted in 2014, treatment completion rates for refugees was about 27%. Some reasons for this are lack of knowledge about the risks of activation and lack of understanding about why they need to take medications when they don't actually feel sick or have any symptoms. So the goal of my health communication campaign is to reduce the incidence rates of active TB cases among refugees in the United States. The outcome and communication objectives are behavioral. The outcome objective is that 65% of refugees exposed to this campaign will have completed their treatment regimen. And then the communication objectives are within 6 months of campaign launch, 60% of refugees will have a change in attitude about completing the full treatment regimen, and 80% of refugees with LTBI will have an increased knowledge about the risks of LTBI. So 2 theories were used to guide my health communication campaign, the theory of planned behavior and the health belief model. These constructs tie into the communication objectives of changing attitudes and increasing knowledge regarding completing the full treatment regimens. For my campaign, there will be a PSA video and an infographic. The PSA video will be played at cultural orientation. Cultural orientation is a 2-day orientation that all refugees have to undergo within 30 days of entering the United States. This is usually broken up by languages and put on by the resettlement agencies that help bring them here. It's designed to orient them to the different aspects of life in the US, like the healthcare system, housing, and the school system. So the PSA will be played in this setting. It will be translated into different languages for the refugees, and it features prominent community members that are males. Using males as the role models is culturally appropriate, as most of the refugee cultures unfortunately have an inferior view on women. The video basically shows 2 males. The first one talks about how he didn't listen to his doctor about completing the treatment and how his LTBI progressed into active TB, and he ends up spreading it to his family and friends. And the video flashes to his family that are really sick and look miserable. The second person talks about listening to his doctor and taking all of his medications, and he's able to keep his family safe, and the video flashes to his family happy and healthy. This is the infographic. It will be presented in an interpersonal clinical setting and is available in different languages. All refugees also have to undergo a health screening within 30 days of arrival into the US. This is in addition to a health screening that they undergo overseas before coming here. And at the overseas appointment, they are diagnosed with LTBI if they have it, and told to follow up with treatment options at their screening appointment here. So this infographic will be handed out to patients with LTBI at this screening appointment, and they will be invited to meet with a nurse who will go over the handout and explain risks, benefits, and treatment options. Each adult patient will get this handout, and the calendar on the bottom will serve as a reminder to take their pills every day and refill at the end of the month for their 4-month-long treatment plan. So for evaluation, I conducted a SMOG test of the infographic, and it is at a 7th grade reading level. There are certain words in there, like the name of the disease, that are unavoidable that raises the reading level. I also conducted a pilot test of the materials using focus groups. Newly arrived refugees were invited to participate and give feedback on the PSA and the infographic. Some of the questions asked were, what is the key point or message of these materials? What do you think of the role models that have been used in this PSA? What do you like or dislike about them? Is there anything you suggest to improve these materials? The feedback was generally positive. The use of the male role models in the video was well received, and the information in the infographics was easy to read and follow, and the fact that they both were translated into all of the languages that the refugees need was a big plus as well. So in conclusion, my health communication campaign is aimed at increasing LTBI treatment completion rates among refugees in the United States. The goal is to increase knowledge about the risks of LTBI and change attitudes regarding compliance. Thanks for watching.